If your knees hurt after running downhill, there is a reason for it, and it may not be what you think. In this video, I'm going to talk about why we get knee pain when we run downhill and how we can fix that. What's up, everyone? My name is Dr. Jason Thomsen. I am a chiropractor in Provo, Utah, and I am also a runner of 24 plus years, a cross-country coach, a track coach, and I love running. And one of my favorite things about running is being able to run downhill. Here in Provo, Utah, we have lots of opportunities to run up hills, down hills, and all over the hills and mountains. However, one of the things I hear most often in my practice and on the sidelines of cross country races and track meets is, why do my knees hurt so much when I run downhill? Well, there's a couple reasons for that. First and foremost, downhill running changes your gait cycle. When you're running on flat ground or going uphill, your stride is going to be a little different than when you're running downhill. When you're running downhill and you have a lot more momentum going, your body is actively trying to keep up with the gravity pulling you down. And what happens is your gait cycle changes just enough to where you're actually having a what's called an eccentric muscle contraction. Eccentric muscle contractions are essentially where your muscle is contracting but lengthening at the same time. So for example, when you're running downhill, your hamstrings and quads are doing a lot of work, but they're also being pulled. Those muscles insert around the knee, above the knee, below the knee, kind of all around that area. And so when we're doing a lot of downhill running, those areas get pulled on, can lead to a lot of different pains in the knee. Another muscle that tends to flare up, especially when we're running downhill, is called the tensor fasciae latae muscle, which you may not have heard of before. But the tensor fasciae latae muscle, or the TFL muscle, eventually becomes what is called the IT band, or the iliotibial band, which, if you've been running long enough, you've probably heard of IT band syndrome. And what that means is that that IT band is being pulled around the edge of the knee. And when you're having that overuse of going downhill, it's being yanked and pulled and rubbing on things and does not feel very good. The other thing that happens when we run downhill is we're loading into the ground at a force greater than if we're going on flat ground or uphill. So imagine for a second that when you're running downhill and gravity's pulling you, but you're trying not to go recklessly down the hill, you're trying to maintain speed. And when your heel hits the ground first, you're basically running with the brakes on. Think about your heel hitting that ground, initial contact, loading phase, and then your body has to carry all that force over the foot. You repeat that over and over and over, step after step, mile after mile. That puts a lot of pressure in the joint itself. Your knee joint is not super complicated when it comes to bones, but there's a lot of soft tissue around it that makes it a little bit more complicated. So your knee is made up of a few different bones. So you have your femur, which is your thigh bone. Then below that, on the other side of your meniscus, you have your tibia and your fibula. Now, in between those bones, you have two meniscus, and those meniscus act as shock absorbers. And so when you're running downhill and you're loading all that force into your feet and it has to travel somewhere, force travels up your tibia straight into those meniscus and gets absorbed there. Now, what can happen is too much downhill running can cause irritation of those meniscus. So one of the characteristic signs of a meniscus injury is you have clicking or there's sensitivity when you step and turn. What can happen is the meniscus is basically just a big kind of piece of cartilage, a big piece of jelly, I guess. And different parts of it are a little bit more firm than other parts, kind of a tougher outer part, softer inner part. And what can happen is the meniscus can actually tear or fray, which could lead to different irritations, which could lead to different kinds of pains in your knee. Now, soft tissue wise, there's a lot of stuff going on in the knee. Like I mentioned before, you have the IT band that wraps down around the outside of the knee and kind of comes down below the knee as well. You also have different ligaments. You have your LCL and your MCL. You also have deep in the knee, you have your ACL and PCL. Those ligaments all act as stabilizers to keep the femur and tibia in place. Now, what can happen is if you step weird on this downhill, there's step off the curb or whatever, you can strain or you could sprain those ligaments, which can also cause some different pains in the knee. Uh, Other forms of soft tissue, you have your quadriceps tendon, which sits above the patella. So your quadriceps muscles, your thigh muscles, become this big tendon, and then you become your patella, and on the other side of patella, you have your patellar tendon. Below that, you have your tibialis anterior and posterior muscles, which are your shin splint muscles. And all of these different things can become aggravated when our gait cycle changes. When we're running downhill and we're causing that change to our form, muscles are going to be worked a little differently. Within the muscle cells themselves, there's a very specific protein called desmin, and desmin is kind of like the door hinge between cells. And what happens is when you run downhill and you're putting all that extra force, especially that eccentric force, those cells, those desmin cells, just become rocked and they shake. It'd be like taking the door on the hinges and shaking it a bunch until things become loose. That's essentially what's happening with too much downhill running. So when you train, it's good to train on downhill occasionally because that downhill running helps strengthen those hinges. It strengthens uh, those desmin proteins. So when it comes to injuries, I have patients show up. I have athletes who come to me at practice and say, "Hey, coach, hey doc, my knees are hurting. What can I do about it?" Well, one of the most important things you could do is, first of all, take care of inflammation. There's different ways to take care of that, and I'll have another video specifically talking about that. But inflammation is a big thing that causes a lot of achiness and stiffness in the joints. Another thing, and probably the most important thing, is you want to be able to strengthen those tendons and strengthen those ligaments. So tendons attach bones to muscles, and when you're moving the muscles, that's what's getting pulled and expanding and contracting over and over and over again. If you can strengthen those tendons through different rehab and prehab things, you're going to become a lot stronger as a runner, but your form downhill will improve and you won't have as much pain when you run down those hills. So some of my go-to exercises, especially for rehabbing and prehabbing the knee, is I tell a lot of my athletes to do wall sits, where you sit against the wall for about 30 seconds or so. That helps activate the muscles and the tendons above and below that patella. Nothing like a deep squat or anything like that, but just enough to where you can feel the burn in the muscles after a little bit. Another thing I tell a lot of patients and a lot of my athletes to do is spend time doing single leg activities. So things like single leg RDLs, single leg squats, lunges, things like that. Because if you can strengthen the one side, if you can strengthen one side at a time, you're going to become a lot stronger. The third thing I tell a lot of runners is improve your balance. And usually this comes back with either some kind of scoffing or laughing because people think, oh, well, I'm perfectly fine balancing. Try this at home. What I want you to do is I want you to stand on one foot, hold it for as long as you can, then switch to the other side. I'm willing to bet money that if you have knee pain, one of your legs is going to be the good leg, and the other leg is going to be not quite as good, and you'll feel some asymmetries and some imbalances from side to side. Spend time strengthening your balance, improving your balance. The more you can improve your balance, the stronger your body and the stronger your legs are going to be. So if you're having knee pain, here's how you take care of it. Hope this has been helpful for you. Hit that thumbs up button, hit that subscribe button, and we'll see you in the next video.